I always believed social justice has been a big thing for me. My philosophy has always been everyone, regardless of where you come from, should have access to care and access to good care. The National Health Service Corps, what it stands for, its philosophy, go practice primary care in an underserved area. Those were the things I've always felt passionate about doing, even before I knew about the scholarship. I was lucky that I was a NHSC scholar. The National Health Service Corps paid for my whole 4 years of medical school. And in return, after I finished my residency training, I would go to work in an area that needs me the most for the same amount of years that I received the scholarship for. Humboldt County is, known for the big giant redwoods. My wife and I were very outdoorsy people. We love hiking.
Are you enjoying yourself, Ivor? Yeah.
In terms of natural geography, this is a great place to live. In terms of socioeconomic status, Humboldt County is actually one of the poorer counties in all of California. A very, very remote part of Northern California. There's not that many specialists around. There's actually not that many physicians around. The organization I work for is the Open Door Community Health Center. Anybody that walks through the door, they feel they are welcome here, and they feel that their medical issues can be addressed. Hi, Trinidad.
Hello.
How are you?
Good, and yourself?
It's very, very important that patients have a place that they can call home, or medical home in this case. And it's mainly for continuity of care. We want our patients to feel comfortable where they go to a place, to a clinic where they know, oh, they know my medical history, they know my social background, they see all of my kids, they see all of my family members.
You're so cute, look at that, and heavy too.
To feel like they know my history and at the same time develop that bond and that trust between you as a patient and your doctor. Cheryl, good seeing you again, okay? We are actually in a mobile van right now. We call it the mobile medical home, where we actually bring medical care to patients who have transportation issues or just can't get to our office. We're able to reach those populations who normally would not seek care anywhere until things get too complicated. That's the thing, I'm trying to prevent you from going to the hospital. When you walk through the door, I could care less, what you do for a living. I could care less what your background is. When you're sitting in front of me, you are my patient and I am your doctor. And in that visit, that's all that matters, and what I can do to address your healthcare and make you the healthiest possible. See how it's not as painful anymore, right?
Yes.
I recently finished my NHSC obligation. I never considered it an obligation. I consider it an opportunity. I feel like I'm a part of a community here where I feel like I'm able to give back to the people around me. I'm able to apply everything that I've learned in terms of my training to be a well-rounded physician. I've been able to provide care to the people who don't have it. They need me here. And as much as they need me, I actually have felt like it's a two-way street here. I felt like they have enriched my experience not only as a physician, but also as a member of the community. My family is able to enjoy all the wonderful surroundings and all the resources that our small community has to offer.